Hello, everybody, and thank you so much for joining me for today's CMA Showcase video. I'm very excited to be joined by none other than Joanna Bilik. Joanna, welcome. Thank you for joining me.
Oh, it's so lovely to see you, Jayney, in person. I'm very honored. Thank you for having
That's okay. Well, likewise, absolutely likewise. You're an amazing lady. I just want to explain to our viewers and listeners today that Joanna, you've been with us here at the CMA for a long time, many years now, and obviously we're delighted, more than delighted, to have you with us. Very, very proud to have you as a CMA member. Also, I think it's better probably coming from you. Would you be able to tell our audience about the work that you do because it is so fascinating?
So I teach sound therapy and gongs in London. I'm accredited by the CMA, and I teach in line with Don Conroe, who has brought sound therapy in the late 1960s into the Western world from India. There is a very unique way of using gongs and sound for therapy. It can be gongs, it could be drums, it could be tuning forks. There is lots of different instruments that you can use that, and it's very beneficial for the health. I also lead sessions. I'm the resident gong therapist at the Shaolin Temple, UK. I also lead events for the seniors and for victims of domestic violence. So we do lots of charitable work and lots of just normal sessions.
Yes, that's so fascinating. So you're giving to so many different sectors of society, which is so incredible. I noticed that you're sitting with this most beautiful. I've never seen such a beautiful gong, actually. Can you tell us a little bit about it?
Yes, so this I actually produce gongs and
Wow.
giant tuning forks and all sorts of different instruments because I'm so passionate about this therapy, holistic therapy. And this beautiful gong is a chakra gong. It is made in Tibet and it's hand painted and it's a nipple gong. So
Oh,
it's pretty unique and has I don't know. Would you like me to demonstrate?
yes, I think you should. Yes, yes, it's too good not to. It looks so
I
stunning.
It's just
Amazing. Wow.
it's a very large 40-inch, so it's on the larger side. It's very heavy and fixed. So
Yes.
it's
Yes.
it's not your usual. I have to be honest with you, I did purposely bring it to
Oh, I know it deserves to have its own show, quite honestly. So it's beautiful.
I love it and the work on it. It's
Yeah,
there's all sorts of different gongs made from different metals. They're
yeah,
usually made in Asia traditionally, and then Germans started copying them. They became popular. So there is a couple of different places that gongs are traditionally made. The Germans make beautiful gongs, obviously, but this is the traditional, Asian, Tibetan, old
yes.
school style.
Gorgeous, absolutely beautiful, Joanna. Thank you. So the thing with sound therapy, I mean, I'm lucky enough. I have a sound therapy class near me that I go to absolutely religiously once a week, and it is so. If somebody hasn't experienced it, it's something that a sound therapy session is something that you do feel throughout your entire body. It's such a rich thing. Now, for those people who don't know anything about sound therapy. Can you talk a little bit about it and what attracted you to this field?
I would love to. So my attraction came from the fact that I have quite a busy mind, and I've always been called into the holistic. I come from a family of doctors and journalists, so my uncle was the doctor for the Olympic team, and my grandfather was a very famous doctor back home as well. So I've always had interest. In medicine. However, I really was drawn into the Eastern medicine, but I was finding it difficult to meditate, to do yoga. I found that you have to really concentrate. But when I first went to a gong bath, I discovered that all you need to do is really lay down. And not many people understand. People think that they need to think in a certain way or breathe in a certain way. It is literally like receiving sun rays on your skin or like hydrating yourself with water. You don't have to do anything. We are, according to a lot of research, made of different frequencies. And there is a belief that our body needs to be between 62 and 70 hertz to be healthy. And once it goes down that frequency, we become simply depressed or ill. So it really helps. It targets this, ancient reptilian, it's called the amygdala brain, and it helps us reach the beta and theta brain waves and really relax us. And it helps with pains and with sleep and with depression and with all sorts of issues. And all you need to do is lay there. And you don't, if people are find it difficult with certain sounds, some people are a little bit more sensitive to sound. It actually, you can have earplugs even because the frequency is, you receive it through your skin, which is your largest organ. Apologies. I could go on for days.
No, actually, please don't apologize. We're going to have to bring you back for a longer session. It is truly, truly fascinating. And I think that people, when we were speaking before we actually started recording this session, you were saying about how many people think that this is just sort of like a hippy dippy woo woo type of therapy. But actually, I always counter that with, well, ultrasound. Sound is different levels of frequencies, isn't it? As you just said, as you said about the human body. And so we use ultrasound therapeutically, we use it for imaging. There are so many things that sound is used for. Sound can even be used as weaponry. So, it is so that the whole sphere of sound, I think, is utterly fascinating. So, therapeutically, what are the sorts of conditions that people might come to you for, aside from relaxation, aside from a wellness exercise, which is so important? What else would you be working with people on?
I have a terminally ill patient at the moment who has cancer, and that really helps. We never say, "Oh, I will make you walk," or "Your leg will grow back," or there's never, we cannot guarantee anything because we are a holistic therapy. We're not an alternative therapy. We always work alongside Western medicine. I mean, the Greeks said diagnosis to diagnose. You always have to go to the doctor first, and then we work alongside. But it, you know, terminal illnesses, pain, heartbreak, depression, because we now know that your mental condition, your mental state is connected to the medical state. I mean, you can get a bunion from moving house from stress. So all of this, we understand, just like a good osteopath, that it is the skeleton and the muscle together, that you shouldn't look at just one. We are looking at the person as a whole, and we always recommend that the intent is the most important thing. So the intent of the person who comes to me and my intent together, and then really anything. Sound therapy can help with any condition. It's not going to guarantee results, but it's certainly going to make you feel better alongside. And I've experienced people forgetting their walking sticks, people being finally able to sleep, people getting rejuvenated. It's personally, I think we should go to a sound therapy session at least once a week. But obviously, I'm possessed by by sound therapy. But anything really. There is a few conditions that you shouldn't
Oh,
come
really?
to.
Right.
So if you have a very rare form of epilepsy, which is triggered by sound, then you shouldn't come. If you have blood clots, very severe clots, you shouldn't be coming. We don't advise women who are less than 3 months pregnant, just because pregnancy is so sensitive, not because sound
Yeah.
therapy in any shape or form affect, but it's just a
Yeah.
precaution,
Yeah.
really.
Yes.
And then if you have any attached, what do you call those objects that you have in the heart?
Like a pacemaker.
Yes, pacemakers are not advisable. So there is a couple of conditions that we don't advise, and also we don't like to use sound therapy on freshly broken bones, just because it can move it around. So we advise,
Yes.
you
Yes.
know,
Actually,
like
that's very interesting because from the homeopathic medicine side of things, again, which is an energy therapy, again with symphytum, which is is a herb. It comes from a herb called breakbone, but we always say with that, do not, although men's bone, do not prescribe it on a freshly broken bone because it will knit the bones so quickly, and if it's not set properly, then you've really got problems. So I imagine it's a similar sort of thing going on. Is that
yes,
right?
yes, they just need to set a little bit first.
Yes,
Just
yes, and be
yeah.
positioned
You
correctly.
would want
Yes,
the mold to set a little bit first
yes,
before starting to move it around.
yes.
Um, so yes, so that's the situation. But really, pretty much anything is I would advise a gong buff for pretty much
Yeah,
anything.
yeah,
Any session.
absolutely.
Well,
Yeah. But it is truly fascinating. And there is a really rapidly growing body of research for sound therapy.
yes,
So, it's not, a few years ago, a few decades ago, even people would have said, oh, yes, it's just, it's a nice thing to have, but, it doesn't really do anything, does it? Whereas, of course, now we do know, we have so much more information. We do know that it is legitimately therapeutic in its own right. So it's very, very exciting. So I'm pretty sure that people listening to you, looking at your beautiful gong there, would love to come and have a session with you, or maybe even train with you. So how do people get hold of you, Joanna?
so it's very simple. I'm gong free. So like free the gong,
Yes.
let everyone gong free. And I also sometimes do events under Gong Temple
Wow.
with when I collaborate with Kwali Kumra, who is a renowned Kundalini master and has been on the sound therapy scene for and Kundalini yoga scene for like 30 years. So we sometimes collaborate together as Gong Temple because she has Kundalini Temple. So when we joined at the hip we Gong Temple, but my me solo is Gong free. And you can contact me at joe@gongfree.com or on my Instagram, which is Gongfree. And I'm very accessible and always willing to discuss training. It's very important to me that my training, I've trained myself with who I considered my inspirations.
Yes.
Don Conroe, Mike Tamburo, Beloved Films, all the big names, I've trained with them. I've trained with some others as well, and I've tried to take on the basics and improve them. And I'm constantly learning. It's very important to me that I pass on the best information and also that I really encourage people to find their own way in facilitating. I always invite guest teachers. So just now we had African drums because of the beat.
Oh, wonderful.
We having a very famous didgeridoo teacher
Oh, lovely.
because
Lovely.
of the briefing. So I include, I like to collaborate with lots of big names. And just now we've made a little biopic about Don Conroe, which is going viral on YouTube.
Yes.
uh,
Yes.
Journey into gongs and sound therapy with Don Conroe. So you can see the interest. There's a huge interest. There's so many people who are, once they are introduced to the gong, they become so passionate that they want to facilitate. And my focus really in life is to make sound therapy as mainstream as yoga is.
Yes.
Just like you have yoga on every corner, I want sound therapy, but good quality sound therapy with people who are trained, properly trained, because I hear too many people saying, "Oh, what do they say? There's something they say, I'm just playing by ear. I don't need training." And it's really, you couldn't be more I don't want to use the word wrong,
Mm,
but this is not correct because the gong is a very different instrument that responds in a very different way. It is not like a piano or like a guitar where you can strike
mm,
uh, notes, and it is not like a drum. The volume control and the response and there are strikes. There is a method. There's a different method to play. Facilitate on a large handheld gong. There are handheld gongs which are very different as well. There's all sorts of different techniques. So please train. Even if it's a one-day workshop, I please urge you, especially, make sure it's an accredited.
CMA accredited, absolutely. Yes, it makes complete sense. But yes, if people can't get to you, of course, I'm absolutely right. Joanna, I think this is wonderful. I mean, obviously, we could go on all day and learning about this incredible art that you do, but we will bring you back for for further events anyway. So I just want to reassure our audience, just in case they're thinking, "Oh no, we're not. It's ending now." So no, it's all good because we do need to hear more from you, Joanna. It's such a fascinating topic, and the way your philosophy about the way you work is so wonderful. So thank you so much for being here today. So enjoyed chatting with
Thank
you.
you for having me, Jenny.
Oh, pleasure.
And have a lovely afternoon and see you very soon. Thank
Thanks.
you.
All the best. Bye bye, love. Bye.